Today we are going to talk about something that can throw a wrench in the plans of anyone trying to start a family: blocked fallopian tubes. Now, I know it sounds a bit technical, but don't worry, I'm here to break it down for you in simple terms. Welcome to Fyne IVF. I am Dr. Dipali and I am the fertility expert with more than 25 years of experience in IVF and fertility. As you already know, ovaries are where the eggs are produced and uterus is where the baby grows. Now imagine your fallopian tubes as finite tunnels that connect the ovaries to the uterus. These tubes play a crucial role in the baby making process by allowing the egg and sperm to meet and eventually form an embryo. But sometimes these tubes can get blocked or kinked and can prevent the egg from reaching the uterus and making it difficult to get pregnant naturally. So what causes these blockages? Well, it can be due to various reasons like infections, scar tissues from past surgeries, or even conditions like endometriosis. It is caused by infection, which we call as PID, or the pelvic inflammatory disease, that can develop through STDs or other untreated infections typically caused by gonorrhea or chlamydia. PID causes inflammation near the fallopian tubes, which can lead to the development of scar tissue and blockages. Past surgeries can also be a cause of damaged or blocked fallopian tubes. In a particular surgery for medical problems like uterine fibroids or endometriosis and other types of abdominal surgery may cause scarring that affects an egg's ability to travel through the fallopian tubes. Endometriosis that develops on or near the fallopian tubes may scar or block the tubes, which can cause tubal infertility. Now, endometriosis is when tissue from a woman's endometrium, that is the lining of the uterus, begins to grow outside of the uterus on other pelvic organs. Ectopic pregnancy also can cause a tubal block. An ectopic pregnancy is when a fertilized egg implants in the fallopian tubes rather than implanting in the uterus. Because fallopian tubes are small and narrow, the fertilized egg does not have the room it needs to grow. This can cause the fallopian tubes to rupture, which is life-threatening and also renders the woman infertile. If a doctor identifies an ectopic pregnancy before the fallopian tube ruptures, then surgery can be performed to remove the fertilized egg. Surgery can lead to fallopian tube scarring and sometimes removal. Now, elective tubal ligation, which is a surgery in which a woman decides to have the ends of her tube cut or blocked to prevent any future pregnancies, also can lead to tubal blocks. This is referred to as having your tubes tied. Tubal ligation, however, can be reversed in some cases, but it requires additional surgeries. Now, coming to symptoms of blocked fallopian tubes. Unlike many other fertility conditions, blocked fallopian tubes do not typically have any associated symptoms. However, many of the conditions that lead to damaged or blocked fallopian tubes do cause symptoms. For example, endometriosis and PID may cause painful periods, pain during intercourse, or heavy bleeding during and between periods. Infertility or having trouble getting pregnant may be the first sign that a woman has in blocked fallopian tubes. In the case of hydrosalpinx, when the fallopian tube has filled with fluid, a woman may also experience abdominal pain and unusual vaginal discharge. Diagnosing blocked fallopian tubes typically involves a combination of medical history assessment, physical exams, and specialized tests. Here are some common methods used to diagnose the condition. First, and a primary test is a hysterosalpingography, or what we call as HSG. This is a common test used to evaluate the condition of the fallopian tubes. A dye is injected into the uterus through the cervix and X-ray images are taken to see if the dye flows freely through the fallopian tubes. Blockages can be identified by the absence of dispillage into the abdominal cavity. Second test is the sonohysterography, the procedure which is done by injecting saline solution into the uterus and using ultrasound instead of an X-ray to visualize the fallopian tubes. It can help detect abnormalities such as blockages or any structural issues. An invasive procedure called as laparoscopy is used in some cases, which is a surgical procedure that may be performed to directly visualize the fallopian tubes and diagnose blockages. A thin light tube with a camera is inserted through a small incision in the abdomen to examine the pelvic organs. Hysteroscopy is a procedure that involves inserting a thin lighted tube with a camera through the cervix to examine the inside of the uterus and openings of the fallopian tubes. It can help identify blockages or other abnormalities in the uterine cavity. Now, after the diagnosis, coming to treatment for blocked fallopian tubes typically depends on the underlying causes and severity of the blockage. Here are some common treatment options that experts providers may recommend. Surgical procedures like tubal cannulation via laparoscopy or hysteroscopy, or in cases of elective tubal ligation, microscopic reversal surgery may be recommended to remove blockages in the fallopian tubes. This can help improve the chances of natural conception. In cases where the blockage is severe and cannot be treated with other methods, removal of fallopian tubes or salpingectomy may be recommended. This can also reduce the risk of ectopic pregnancy in the future. This procedure also improves the likelihood of conceiving through IVF more than the other possible surgical treatments. Now, last but not the least, in vitro fertilization. IVF is a popular option for couples facing blocked fallopian tubes. It involves retrieving the eggs from the ovaries, fertilizing them with sperm in a lab, and transferring the resulting embryos into the uterus. This bypasses the need for open fallopian tubes. If you suspect you have blocked fallopian tubes or are experiencing fertility issues, it is important to consult with a fertility expert. They can recommend appropriate diagnostic tests based on your individual circumstances and help develop a personalized treatment plan to address any underlying issues. Early detection and intervention can improve the chances of successful conception and pregnancy. It's important to remember that having blocked fallopian tubes doesn't mean the end of your journey to parenthood. With the right medical support and a positive attitude, many people have been able to overcome this obstacle and fulfill their dreams of starting a family. Good luck on your fertility journey. Thanks for watching and feel free to like and subscribe our channel.